What determines the type of thumb splint that you provide to your patients? Can I show you the best one that's available in the marketplace? John Hely developed the Titan Thumb as a great overall solution for the treatment of thumb injuries. In its design and construction, it is the brace I show to most surgeons when they're unfamiliar with what Hely Weber products can do for their patients. Hely Weber works with caregivers to develop splints that can be adjusted to the patient, minimizing needs for inventory, reducing SKUs as much as 80%, and accomplish the treatment goals at the highest level of quality and comfort that can be offered. The Titan Thumb is 4 stays that can be modified to the patient, to the size and the position we want to put the patient in. How I show the brace is simple. Open up all of the straps and undo the Velcro in all areas. And we bring it down just to the base of the product. The body of the product is made from a needle-punched polypropylene material that wicks the moisture away from the skin and breathes and allows moisture to dissipate. So it's very, very comfortable and a very durable material to make the brace from. We slide the hand into the splint, over the thumb, and you can determine whether you want to position the brace above, or below, or above the interphalangeal joint. Normally we keep the IP free, so we take the heaviest strap and we run it through the web space of the thumb, and then secure the thumb with these 2 16th inch straps that wrap around the thumb. You can cross them over, you can wrap them in sequence, and you can even cut one off if you so desire. The only adjustment to the splint that's necessary is a lateral adjustment to block ulnar deviation. And we do that with this lateral stay pod, positioning the splint to the wrist. Now you note here that there's some gapping that occurs, so we can easily bend this stay to accommodate the contours of the hand, and then simply wrap the splint up using the wrist strap first, wrap it around, and then the forearm strap, which accommodates larger or smaller forearms, and wrap it up. What's so unique about this product is the fact that we're now able not just to hold the thumb in an abducted position, but we're also able to bend the thumb or move the thumb into a more functional position with these 2 stays that are wrapped around the thumb. And how we do that, and I would probably recommend you bend these off the patient prior to putting it on, but how we do that is simply press on the thumb and bend the thumb down into the proper position. We've now got that hand in a functional position, or what we commonly know as the beer can or pop can position, so they can squeeze. Once the splint is applied, the only question we get from people is, it looks like it's going to be very difficult for our patients to take on and off. The fact is that just simply loosen the straps, open the splint up, slide it off the patient's arm, slide it back onto the patient's hand, and you can see how simple the reapplication of the brace is. Tighten up the wrist strap first. Tighten up the forearm strap second. And the brace is fit back on the patient. A couple of other things to point out is that in the brace, all the binding on the brace has been made with a brushed binding. It's really a baby blanket soft binding to be super, super comfortable for the patient. And of course, we always know that comfort yields compliance. If it feels good, they're gonna wear it. The second thing we've done here is we've incorporated, instead of using rivets, we've actually incorporated an integral plastic eyelet that actually runs right along the side of this brace. It gives a very contoured fit to the patient, a very low profile fit to the patient. How does that feel?
Very good.